Hi, I am 2 days shy of 4 months, 4 weeks, not months, 4 weeks post-op top surgery. I had surgery with Dr. Crane and Dr. Satterwhite in the San Francisco Bay Area. I've made other videos about my experience with that, but I'll just say I like both of them, and I was happy with the experience, happy with my results. So at this point, at 4 weeks, the healing is going quite well. I've had no complications at all. I don't think there's been any, roadblock in my healing. It's going well, so that's good. I'm still limited, of course. I mean, I'm not supposed to raise my arm up, completely straight all the way till a month after surgery, which is really coming up, which I'm happy about, because it is a bummer to not be able to move and stretch all the way. I feel pretty able, I feel like my normal strength, in the week after surgery, when I would look at a grocery bag with food in it, I was like, I'm not lifting that, I can't lift that. But now I'm like, yeah, I feel as if I could lift stuff that I normally lift. But I'm not lifting very much because I'm doing my best to follow the directions and to not put strain on my chest because I don't want to mess up the healing. But I am really frustrated with not being able to exercise, to do upper body exercise. I'm feeling really antsy about that, and I feel like I could do push-ups. I have not tried, I'm not going to try right now, but my point is that I feel good. I'm not in pain at all at this point. If I, press on the incision area, then that does hurt, but in the normal course of things, I don't have pain. I can hug people normally with no pain. I even picked up a dog today, a 40-pound dog, which I hope did not mess anything up. So I guess I can show it to you. It doesn't look different than before, really. I have the gauze on the nipples, which I was going to take off, and I forgot. So it's not, it's it's slightly gory, so just know that before you choose to look. There you go. Turn around. Yes, I am still living in a tent, but I do have a place to live, which I'm moving into in 2 days. So that's good. Yeah, the scars obviously look super red. I feel like in real life they don't look quite that red as they do in the video. In the video it looks as if they're raw, but the incision scars are not raw, they're completely closed. Not at all raw, they're just red. So let me see if I can, I'll take one of these off so that you can see it. So if you don't, it's not really raw anymore so much, but if you may want to, well, you can use your judgment if you want to see it. Let's see, how's that doing? Oh, wow. Yeah, it's looking pretty good today. Check that out. You can't really tell that much from that distance. I'm sorry if it's gross. That's how it is. Yeah, it's kind of gross. But it's infinitely less gross than it was in weeks past. It's pretty cool. I like it. I'm 3 weeks post the unveiling. I've had the giant bandage off for 3 weeks, and I still have the gauze on, because the nipples are not quite 100% not raw, but they're getting there. They're definitely improving a lot every day. What else? Well, I'm just happy with the results. I'm happy with how everything looks and how it's placed. I mean, it's so amazing to, like, touch my chest and just feel the muscle and nothing else. It just feels good and natural, and it just feels how it's supposed to be. Like, I do not miss my boobs. I have not had one moment of missing them. I don't think about them that much. Yeah, I just love being able to put on a shirt and go out and nothing else. Yeah, and it's so cool to just feel more free, you know, have the breeze go in there. It's really nice. I love it. I'm just really happy that I had top surgery, for sure. And, other feelings, I've been feeling a bit impatient just going through the healing process because it feels to me kind of like waiting for Christmas or something, because I have this here, which I'm happy with, and I know that I'm gonna really love in the future, especially when I can unwrap it, you know, like unwrapping a Christmas present, like not have the gauze on anymore, and not have to wear any of the scar tape, which I don't have on at the moment, and just be free. Because, I mean, having the gauze and stuff on, it almost feels, like, slightly reminiscent in some ways of wearing a sports bra or something. So I just want it off. I want to unwrap the present and be able to enjoy it. And, you know, to be able to, after a year, when I'm allowed to have it in the sun, be outside without a shirt on and go swimming. Be able to wear the seatbelt across here, which I haven't yet, because it's irritating. So I'm just impatient for that. But I'm getting close, so it's alright. And another emotion, feeling kind of thing, is that I often, like, usually at least once a day, I have this, like, split second where I feel uncomfortable, or I have a moment of anxiety. Like, I'll be walking around and then there's like a gust of wind or something, and I can feel the wind in my shirt, and I have this moment where I'm like, oh my god, like I almost feel naked, the way that I would have felt if I was out and about before, pre-surgery, without a sports bra or a binder on. Like, that would make me so anxious. I never did that. Be like, oh, I feel naked, and it's like people can see my boobs, and I don't like that. Oh my god. So I have that kind of a moment pretty frequently, just for a second, and then I'm like, oh yeah, I remember. There's nothing there, really. It's fine if all I have on is just one t-shirt and nothing else. So that takes some getting used to. But I'm sure that once I do get used to it, I'll feel awesome, because I do feel awesome about it much of the time already. Well, I don't know if I have much more to say about it. I could give a quick update about the scar tape that I have been using, which I talked about in my, like, 1 week post-op video. It's called Embrace, you know, embrace like a hug. For one thing, I feel like it probably helps. You know, I'm not to the end point yet, so I can't give a final conclusion, but I think it probably helps because when I have it on, especially in previous weeks, when I was at an earlier stage of healing, I could really tell that it was preventing the scar area from stretching, because when I would not have the tape on, when I would sort of reach or something, I could feel a slightly painful pulling at the incision line. It was a little sore, but when I have the tape on, I did not have that, so that's probably good. But then on the other hand, it's kind of uncomfortable. I mean, in the larger scheme of things, it's not really that uncomfortable. It's just tape. But, I'm just so ready to not have anything on my chest. And it's like I know that the tape will help me and will protect the incision scars. But I'm gonna put the tape back on, but I do feel kind of reluctant just because I'm so eager to not have anything on it. Yeah, and it is hard to make it so that the scar tape does not come off in the shower, or just does not come off sooner than it's supposed to in general. I've had some trouble with that, but I'm working on it. Well... Oh, yeah, I could talk about sensation. So... I don't think sensation has really changed that much in the last few weeks. But I think it's starting to change because I feel as if I've had some slight pain, like, at the nipples. I mean, it's weird because on one hand they're numb. Like, if I go like that to the nipple area, I can't feel it on the skin. If I press, I can feel it, like, underneath, you know? Like, the muscle can feel pressing, but the skin can't feel it. But at the same time, once in a while, I'll get a slight sensation of pain, like, at the nipple. So I wonder if the new skin, like the graft, is connecting in terms of the nerves somehow. So that's promising, I think. I've also had some moments of itching at the nipples, which I feel is probably promising, because that would indicate, you know, the skin and nerves connecting. And it's totally numb at the incision, and like a little bit above and below the incision. Although, I can feel that. Well, but I guess that's where the incision ends. Yeah. It's weird having it be numb. Like, when I'm in the shower, when I'm, you know, washing myself, every time I have to make myself consciously aware of the fact, like, remind myself that the nipples, and also the incision, but more importantly the nipples, are numb. So it's like I can't be, like, going like this, like, oh, I don't feel any pain, that means I'm not causing any harm. Like, no, I could be doing this and not watching, and, like, taking the nipple off. So I guess that's a little tip, which might be obvious. When you're taking a shower post-op, you have to watch what you're doing so that you're not, like, making it bleed all over the place without realizing it, because it's numb. So that's strange. Well, feel free to let me know if you have any questions. Yeah, I guess that's about it. And when the nipples are a little less gross farther down the line, I'll do a more in-depth show and tell. Okay? Alright, thanks for watching. Bye.